recording. So today we're pulling back the curtain on our newest NCLEX-style simulation scenario built to reflect the complexity of the 2026 exam. So today we're going to walk through exactly how it works, why it was designed this way, what it means for your students. But a few quick housekeeping notes before we dive in. The session is being recorded, as you just heard, and I'll be sharing the recording with all the registrants after it's done processing. So be on the lookout for that, for any emails that come from PCS.ai. So check your junk, check your spam, make sure we're getting through. We do have a Q&A session at the end, and we'd love to hear from you. But go ahead and drop your questions in the chat as we go. We're going to try to answer as many of them live as we can. If there's a question that requires maybe more of an in-depth response, we'll follow up with you directly post-webinar. You're also going to see a poll coming up in a minute. Maybe take a few seconds to respond to that. It helps us understand where you're coming from, and hopefully it will help shape the conversation. And finally, we want this to be interactive. We're kind of a small, purposely so, group today. So if something sparks a thought, drop that in the chat as well. All right, let's get into it. My name is Michelle Castleberry. I'm a co-founder at PCS.ai. I am not important today in the least. My two colleagues, though, are joining me today is Sarah Turkstra, a key clinical member of our content team. She is the one that leads the scenario development and works directly on the reinforcement learning for our AI. Sarah is the person most responsible for the coordination and the clinical depth you're going to be seeing today. Also with us is Nick Stoic, our VP of Sales and Head of Partnership and Business Development. Both Nick and Sarah were at INACSL just a couple weeks ago. So if you stop by the booth, maybe their faces look familiar to you. If you had questions that you didn't get to, or you thought of questions from INACSL, to now, consider this your chance. We want this to, as I mentioned, be kind of a conversation with the folks that built this. And one more introduction coming a little bit later. You'll get to meet Maya. Is it Sarah? You'll help me with this. The pronunciation of her last name, is it Reyes?
Yeah, it's Maya Reyes.
Maya Reyes. Okay. Our AI-driven digital patient and star of today's scenario walkthrough. And just as a note, one of the things that I like to do with all PCS webinars is go to ChatGPT, use the image creation, and create fun little photos of all of the presenters. You'll notice I'm using a World Cup bobblehead image creation today. So let's continue on. So before we, as I mentioned, before we get really into the slides, this is the poll that I was talking about. So I'm going to launch the poll now. So you should be seeing that. So I'll give everybody a chance to maybe take a look at that. How does your program approach NCLEX preparation? A, it's fully integrated into your curriculum. B, you dedicate some class time, but students mostly prep on their own. Or C, you consider simulation your prep because it builds that clinical judgment that the NCLEX is testing for. D, it's largely left to students to handle independently. Or E, we're actively reworking our approach right now. This is the perfect time. I wish Zoom had like a Jeopardy, like do, 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 as folks answer the poll. And it looks like everybody, we're going to end the poll here. So it looks like that it's fully integrated and that you've dedicated some class time. So that's great. It's always a revealing question. I kind of love, let's see if I click stop sharing on the poll. It's always interesting to see kind of the mixed responses. If no one selected C, but if you did feel maybe that was another option that you were considering testing, you're going to feel very good about today because that's the philosophy behind everything that we're about to show you. So if it's integrated or if it's dedicated with some class time and it's fully integrated, it already existing in your program is a really good thing. And if you're doing simulation, that is a good, kind of an example of what simulation kind of trains is that shift towards clinical judgment case studies, bow tie questions. We'll get into that more in a minute. And what we want is to make sure, especially with simulation and answers A and B, it's about making sure new nurses can actually think on their feet and be ready for clinical real clinical life. So with that, I am going to now hand it over to Sarah. So I'm going to stop sharing my screen, and she is going to start sharing hers.
Okay. Are we all seeing the definitions page?
We
Okay.
got it.
Awesome. Okay, so hi everybody. I'm Sarah. I'm a registered nurse and I work for PCS, like Michelle said, and I help develop the case studies and scenarios. And like Michelle also said, my brain was kind of behind a lot of what we're going to see here today. So if you hate it, that's on me. Just kidding. Okay, so let's start with some key terminology. So before we get into it, so the NCLEX competencies. So these are all of the elements that learners are going to be tested on through the NCLEX. This is something that we really want to target, as this is how the NCLEX is broken up. The key topics being management of care, safety and infection control, health promotion and maintenance, health, psychosocial integrity, basic care and comfort, the pharmacology side, the reduction of risks, and the physiological adaptations. So one of the keys for this is that we're trying to target the case studies, as this is one of the tricky parts of the NCLEX. I actually wrote the NCLEX about 3 months ago, and this was definitely the part of my studying that I always found to be the most daunting. So we really wanted to target that real world scenario learning, both for the NCLEX as well as real world nursing. So one of the ways we're doing that is structuring with kind of that bow tie structure. So we have a visual representation that links the diagnosis, or what the learners assume the diagnosis is, with the interventions and actions that are appropriate, as well as thinking about the complications that the patient might experience down the line. And these are all with the focus on clinical judgment questions, which is kind of key to nursing and nursing school in general, that clinical judgment model. So the key elements with NCLEX through PCS is, like I said, we're mastering the case study. So what we want is for learners to step inside simulations, they get to make real world decisions, and they also are preparing themselves and familiarizing themselves with an NCLEX style environment and verbiage. They're going to be learning through direct contact. So these cases are going to be enacting and directing and focusing on the 8 core competencies. So if learners are to experience all 8, plus once, we have 9 of our patients, they by the end should feel more confident in their preparation and more familiar with the verbiage that they may experience on the exam. The key here is that we want to have learners experience this authentic learning environment where it's designed to help stimulate NCLEX style thinking, but also simulate the real world of being a nurse. So they're preparing for their own journeys as a nurse after nursing school. So let's talk about how we NCLEXified this resource set. So one of the things that you'll start the simulation is you start with some patient file information. This is in the information that you would see on the exam that is always presented to learners. It's information that they don't have to elicit, and it's given to them so that they can start. If they're to complete a verbal focused assessment and really run through the simulation, the whole environment will work in its favor for the complexity, but the patient file will start the learner off with the necessary information. We also have simulated NCLEX structuring. So this is through our diagnose and treat tab, like I was saying with the bow tie structures. So the diagnose and treat tab, if you're familiar, it has 4 tabs. What we now have is the diagnostic results, so learners can view labs and imaging and orders. They can select what they believe the diagnosis to be, and then select nursing interventions and complications that are related to that condition. This is what we're talking about with the bow tie case study style questions, and that's kind of that simulated format. At the end of the simulation, they'll also have an NCLEX style quiz. This quiz uses the verbiage that's familiar to the NCLEX and represents the core competency that that simulation is focused on. And at the end of each simulation, there's a complete assessment as well as a debriefing page. The debriefing page covers the correct and incorrect responses for all of the tabs so that learners are learning both on their ability to perform correctly, but also from their mistakes. So overall, what really makes this resource set different is the diagnose and treat tab, which is simulating that bow tie structure. So having learners understand and being able to formulate a diagnosis for the patient, understand the interventions that are required and indicated or not indicated, and then understand the complications and the future progression that the patient might experience. The structured debriefing, like I said, includes the rationale for both correct and incorrect responses. The key here, I think, is the incorrect responses. There's no better learning than making a mistake. And so we really wanted to provide learners with the opportunity for learning in every situation. And then that NCLEX-style quiz gives that the actual, object of completing a quiz, which is what the NCLEX is at the end of the day. It's an exam with multiple choice. So simulating that also familiarizes learners with the NCLEX itself. So our first scenario is Miss Maya Reyes. So she is special in the sense that she targets all 8 core competencies. I'm going to talk a little bit later about the future patients, each reflecting a competency, but Miss Maya, she reflects all 8, and the goal here is that she is very high level. So she encapsulates a lot of knowledge and learning that is required for the NCLEX. Specifically that she is a maternal patient experiencing distress, which is a very high yield concept on the NCLEX. And another part of her case is that she has built-in physiological responses. So when learners are giving treatment, her vital signs will change, which will, influence the learners and show the progression of the patient. So let's get into Miss Maya a little bit more. So she's a 29-year-old. This is her second pregnancy. She's 36 weeks pregnant, and now she's suddenly having a headache and some blurry vision, and the Tylenol is not helping. To make matters worse, she's now feeling like she might be having contractions, and really unfortunately for her is she's having some painful genital lesions. Now, the key takeaway with this is we wanted her to be very high yield. And so what makes this high yield is that she's experiencing preterm labor as well as the preeclampsia. And then she also has HSV lesions. And so there's some education involved where the learner is going to need to talk to her about this because she's not aware of what's going on with her own body. So this is both practice for the NCLEX and that high level and high yield learning, as well as practicing real life conversations with patients in the clinical setting where they'll be having conversations with patients with maybe difficult conversations. So what are learners doing when they enter the simulation? So they're going to start with some encounter instructions. So this is a part of the patient file. They're going to get their baseline information, and then they're also going to be instructed on how to complete the simulation successfully. Then they're going to start their assessment phase. Here they're going to, do their vitals, complete a verbal health assessment and review symptoms, as well as complete a physical assessment. This is where they're generating most of where they think they're going to go next. They finally can go into the diagnose and treat tab and review the diagnostics. This should finalize the diagnosis in the learner's brain about what the patient is experiencing. So they'll go through labs, CBC, things like that, and be able to use that just like you would on the NCLEX. Then they'll select their diagnosis, just like you would in a bow tie style question, as well as the nursing interventions that you believe are indicated. When an intervention that's not indicated is selected, it will pop up on the screen that the intervention's not indicated, and then students can refer to the debrief for further learning. And then they'll also be able to identify those complications that might occur later for that patient. We also have some optional steps. These optional steps are not graded, but these are the keys where the diagnose and treat is really about the NCLEX, but these optional steps are really for being a nurse. So my favorite is calling the provider and completing an SBAR. It's one of the scariest things I think about starting as a new nurse is being able to confidently discuss a case with a provider. And so being able to do that in the simulation is really meant for that future nurse's true clinical experience. And then we also have the ability for the learners to be documenting their findings in a SOAP note style, much like they'll have to be doing once they enter practice. And so both of these combined with the NCLEX style and the real nursing completes a full simulation of that nursing experience. So what are the learners actually learning when they do this simulation? So the first thing they're going to be learning is communication. So they're able to talk to the patient and experience that full verbal rapport. With Maya specifically, she has a complex scenario as well as some difficult conversations. And so learners have the ability to practice all levels of their communication. They're also able to complete a physical exam where they can actively interpret the physical findings. And then same with the diagnostics. So they can interpret lab results, much like you would have to do on the NCLEX as well as in real life. Then comes the clinical decision making, which is really the core, which is the diagnostics, the interventions, and the complications, like I've said. So these together are really going to simulate that NCLEX-style thinking that's responsible for understanding the case study. Finally, they'll have the quiz and the structured debrief. So the quiz is going to reinforce the specific NCLEX verbiage, as well as that multiple choice options. And the structured debrief is the real opportunity to reflect on their learning and understand where maybe they went right, but also where they went wrong. We love having the correct responses as well debrief, because even if you make a correct choice, understanding the reasoning behind it is where the learning comes from. So we wanted to provide everything so learners can feel confident in understanding why things are incorrect or correct. So the big picture. So this platform is designed so that learners are able to demonstrate and focus on all 8 core NCLEX competencies through the learner assessments, the D&T items, and the quiz questions. Together, this creates a full comprehensive coverage that's both designed for NCLEX preparation as well as real-life nursing preparation. So let's talk about the next patients, like I said at the beginning. So we have 9 patients in total that are NCLEXified. The first patient being Maya, and the key to her is that she targets all 8 competencies. When you run a Maya simulation, you're targeting everything. Then we have 8 of other patients, and each patient represents a specific competency. And so the nursing interventions and the quiz-based questions are focused on that competency in particular. So we have Mackenzie Sawyer, she's having an allergic reaction, and she's all about management of care. We have Juan Garcia, he's experiencing tuberculosis as well as HIV, and so that's all about safety and infection control. We have Anthony, who's experiencing a kidney injury, so health promotion and maintenance is key for him. Eric Evans had just had a suicide attempt, and so the psychosocial integrity competency is key for him. We have Doris Berg, and she's having a UTI and some confusion related to that. So this is all about the basic care and comfort, as this is a very common condition. We have Vanessa Johnson. She's struggling with her medications, and so this focuses on the pharmacological and the parental therapies. And then we have Mike. He has congestive heart failure, so we're focusing on reducing his risk. And then we have Chloe. She's our pediatric patient, and she's experiencing appendicitis, and so it's all about how the body is responding to that. So all together, these patients are going to have comprehensive coverage for all 8 of the competencies. So before we end this portion of the webinar, we do have a key disclaimer. So these simulations are designed for educational purposes only, and they're designed to support NCLEX-style clinical reasoning and complement, not replace, nursing education, clinical placements, or exam preparation materials that already exist. And these scenarios, of course, can be adapted to meet your needs, whether making more complex or less, whatever needs to be tailored. This was also designed with a 2026 NCLEX model in mind. And with that, thanks for listening, and I'll move it back over to Michelle.
Thanks, Sarah. Fantastic breakdown, as always, of how the scenario was built and why it matters. Now we're going to stop talking about it, and we're going to show you. Nick is going to log in, walk us through Maya Reyes, and as you watch this live interaction, look for those 8 competencies that Sarah was talking about in real time, from that initial assessment through the clinical decision making. Of course, we're going to be moving through this a little faster than I think a learner would. This is kind of like a highlight reel, not the full feature length runtime, but hopefully it gives you a clear picture of what the experience feels like from start to finish. If you have questions or want to take a longer look or a more in-depth look, then Nick and team can certainly set up time to do that with you one-on-one, or with your institution and anybody that you want to involve. So with that, Nick, take it away. The screen is all yours.
Perfect. Thanks, Michelle. And I assume you can see my screen here as well. That's looking good. Excellent.
Perfect.
And so, like Michelle said, I'm going to go ahead and walk through this scenario here. Quick note, though, I'm not clinical. So, Sarah, feel free to add any additional color as I'm kind of going through this encounter. But yeah, I'll kind of do this as an overview of Spark as well. So for those of you who are not familiar with Spark, or this is your first time seeing it, I'll kind of point out some of the key elements to the simulation as well. So first thing we're looking at here, I've just started up the simulation a few minutes before Sarah ended her presentation. And so we'll see this getting started message every time a simulation begins. This is simply to kind of remind learners of some of the key controls, like how to communicate with a patient, how to conduct a physical exam, and then what other resources are available to us during the simulation. If this is the first time that you've actually run a simulation, there's also the option to go through a tutorial that'll kind of walk you through some of those key controls. But I'll just click go ahead. Okay, got it. And then we'll see Maya sitting in front of us. Obviously, she looks a little uncomfortable, so we'll want to start talking with her pretty quickly here. So the door notes, those will pop up at the beginning as well. That just kind of gives kind of an overview of the scenario and also instructions to the learner. For now, though, I'm going to dismiss this so we can kind of see Maya in her full screen view here. Probably first thing I should do is introduce myself and kind of see what is going on with Maya from her own perspective. So I'll go ahead and do just that. Hi there, my name is Nurse Nick. What's your name?
Hi, Nurse Nick. My name is Maya.
All right, Maya, and what brings you into the hospital today?
I've got this insane headache that won't go away, and I'm really nervous. I'm having contractions. My doctor said I should get checked out for a headache, and I'm getting worried.
Okay. Well, I'm definitely glad you came into the hospital. Don't worry, we'll take good care of you. How far along are you in your pregnancy?
I'm 36 weeks pregnant.
Okay. And do you know the gender of the baby?
Yes, I'm having a girl.
Oh, congratulations. First kid?
Thank you. This will be my second baby.
Okay. Well, let's get back to the task at hand here. Tell me a little bit more about the headaches. When did they first start?
I started getting headaches this morning, but I've had lighter headaches on and off for the past few days that I didn't think much of at first.
Okay. And if you had to rate the pain on a scale of 1 to 10, what would you rate it?
Right now, it feels like a 7.
Okay. That's pretty bad. Any other associated symptoms that you've noticed that go along with the headaches?
I've also started cramping.
Okay. Have you noticed any changes in your vision?
This is weird. My vision has been blurry, like I'm looking through a fog.
Okay. Have you thrown up or vomited at all?
No, I haven't.
Okay. Well, let's do this. I'm going to go ahead and get you hooked up to the vital sign monitor here, and we'll check your vitals and kind of go from there. Does that sound okay?
Yes, that sounds okay.
So I'm just going to pause it here for a moment before we hook Maya up to the vital sign monitor. A few things I always like to point out with the communication. First off, nothing is scripted, so it's really going to be up to the learners to identify, what the best questions to ask their patient are, and then based on the response that Maya or any other scenario gives, kind of build your follow-up questions around that. And then obviously every learner, they're going to phrase their question in their own way. And that's where the power of, the communication engine is able to come in, understand, and then respond back with that scenario specific response. So with that in mind, I'm going to change my view over here to the left, and we'll see we have a vital sign monitor. So I can grab these different attachments here and kind of put them on Maya so we can get kind of a full reading of her vital signs. So if I do that, and then come over here to kind of look more closely at the vital signs, certainly we can see blood pressure is pretty darn high, so something we're going to be concerned about. Respiratory rate's also pretty high, so something for us to keep in mind as well. Let's go ahead and let Maya know this, and we'll kind of come up with a treatment plan for her. So I'll dismiss the vital signs here. All right, Maya. So it looks like your blood pressure is pretty high at the moment. I'm just curious, have you been monitoring your blood pressure at home?
No, I haven't been monitoring my blood pressure at home. My doctor told me to go to the ER if I felt headaches or vision changes. So I
Okay.
thought I should go to the ER just to make sure everything is okay.
Yeah, no, certainly glad you came in, and don't worry, we're going to get you taken care of. And I guess before I move on to the physical exam, maybe if you could let me know, are there any other symptoms or concerns you're having aside from the headaches and the cramps?
I also feel a burning sensation around my vulvar area.
Okay. How long has that been going on for?
It started a few days ago.
Okay. Do you have any history of STIs?
No, I don't have any history of STIs.
Okay. That's good to know. All right, so let's do this. I'm going to go ahead and take a closer look. Is it okay if I take a listen to your heart and lung sounds?
Sure, I don't mind.
All right. So, once we've kind of gathered all that information, we can move into the physical exam. So that is an option that we have here. So to do the physical exam, all I need to do is click on this button down here in the bottom left, and that's going to change the positioning of the bed here. And I've got a few additional tools that I can use to take a closer look at our patient. So, for example, if I wanted to listen to her heart sounds, her lung sounds, her bowel sounds, I can grab the stethoscope here, place it down on the patient's heart sounds, listen to those lung sounds, and make sure that they all sound normal. Obviously, her heart rate's pretty fast, so we'll hear that reflected in the auscultation. In addition to auscultation, though, I also have the ability to um, uh, look more closely at eyes, ears, nose, mouth, skin. With the glove tool, I can also palpate different regions of the body. So if I want to palpate the abdomen, I can do that with the glove or the hand tool here and kind of get an indication if there's anything abnormal sort of popping up there. In addition to that, with the physical inspections, if there's areas on the body that I can't click on per se, I do have the option to get some additional results here. So, for example, she had mentioned that there was some, burning sensation in her groin area. I could choose to do an external pelvic exam and then immediately get the results of that. So it looks like for Maya, even though she indicated verbally that she didn't have a history of STIs, maybe it was something that she didn't necessarily want to talk about. If I, perform that external pelvic exam, I'm actually seeing that there are some lesions here in her genitals that, is certainly something to be aware of. And, I'll probably want to take a closer look at her diagnostic results to see if there's anything indicated there. So that's the physical inspections. What I'm going to do now is kind of exit that and get her back sitting up. And then once I do that, I'm going to move over to this diagnose and treat window. And this is really where a lot of that kind of NCLEX reasoning comes into play. So if I click on first that diagnostic results, so these are already, orders and labs that have been, requested and ordered. So I have the ability to basically, I'm just going to pop this over to the middle here so it's a bigger view, take a look at if there's anything, abnormal that I should be aware of. Specifically, let's take a look. If we take a look at this infectious disease results here, I can take a look that, she did in fact test positive for, HSV1 and 2. So it's possible there that she's having, an active outbreak. And certainly that's something that we want to take into consideration, being that she's, about to go into labor. And again, I can go through and, take a look at all of these results. No reason necessarily not to. They're all available to me. They've already been ordered. It's not like I'm ordering them again per se. And then once I have the, kind of clearer picture, having looked at all of these diagnostic results, I can go into this diagnosis window, and kind of put what I believe to be, my diagnosis, of what's going on with the patient. Obviously, with the, pretty high blood pressure, the complaints of headaches, she's most likely experiencing some kind of preeclampsia. And then with that burning and, the visualization of the lesions on the genitals, she most likely also has that active genital HSV infection. Sarah,
to jump
anything
in,
else?
can I jump in? Yeah, I was about to
Yeah,
say,
yeah.
as the clinician, so one thing that we did put in here, we made it a little tricky, having the preeclampsia as well as severe preeclampsia. So if we really want Nick to get the point, we do need to select severe preeclampsia, as indicated with her visual changes. So that's kind of that key that differentiates those things. So that's gonna allow us to be successful here. So that's all
Okay,
I'll
yeah,
say.
good, because
Come
I
on,
would have
Nick.
missed the points there. So good to know. Phone a friend came in handy there. So yeah, I'll leave the diagnosis as these two for now, and then once the simulation is over, we'll see if I got kind of full credit in the diagnosis section. Next up are the nursing interventions. So what possible actions I can take to kind of help with the patient. One of the things that we're going to certainly want to, get under control is that high blood pressure. So I do have the option to initiate that magnesium sulfate for the severe preeclampsia. So when I click on that, I will get, intervention indicated, and then also to refer to that debriefing page at the end of the simulation to kind of learn more about why this specific intervention was indicated. Now, let's say I, chose an option that was not indicated. So, for example, administering antibiotics for, a UTI. If I were to click on that, I will get instead a red indicator saying, hey, this intervention is not indicated. And again, please refer to the debriefing page at the end of the simulation. Let's see, probably some few other things that we'll want to do is, obviously with the HSV outbreak, rather than having a vaginal delivery, we're going to want to prepare the patient for that cesarean delivery. So I'll go ahead and click on that as well. And then, I get that green highlight, intervention indicated. So all is well there. I'm not going to go through and choose every single intervention here, but that kind of gives you an idea of what the intervention section looks like. And then last up are the complications. So choosing, the potential complications that could be going on with the patient. And that's going to be very similar to the intervention side. In this case, let's say, eclampsia, and then I can click on this little eye here to see if that is a complication that's indicated or not. So for example, if I were to say, deep vein thrombosis, in this case, that complication is not indicated. And again, I could go through here and, try and get all of the ones that are indicated as opposed to not indicated. Sarah, did you want to add anything to that portion?
I think you basically covered it. Thanks.
Okay, perfect. So then at the end of the simulation, once I've kind of worked through all of this, then, I could say some parting words to Maya, but in this case, I'm just going to click on this little arrow button up here at the top right. That is going to end the simulation. I'll just get a confirmation message making sure that I want to end the simulation so nothing's done. you know, unintendedly. And then, as Sarah had mentioned, we have this, multiple choice NCLEX-style quiz that shows up here at the end of the simulation. So first starting off, the provider orders, and I'm going to probably butcher this name here, labetalol, 20 milligram IV push for severe hypertension. We have an available labetalol for 5 milligrams. How many milliliters will the nurse administer? I've done a little bit of cheating here, so I already know the answer, and I'm going to put in 4 milliliters for that. Let's see, the patient has active genital HSV lesions and is in labor. What is the appropriate nursing action? So prepare for vaginal delivery, initiate contact precautions, discontinue fetal monitoring, or apply internal fetal scalp electrode. In this case, because of the active outbreak, we're going to go with initiate contact precautions. And again, there's many different questions on here. I'm just going to choose a few random ones for these last answers or questions here, just so we don't have to go through every one, but I'll get my results here at the end. So now the simulation is over. I see this debriefing content in front of me. So as those different interventions and complications indicated, I can kind of read through here and see what the rationale is for the correct actions and the incorrect actions, and kind of read through, get a better understanding of all of those. And then as I scroll down further, I'll also see the quiz rationale, which is great. But then lastly, I'll have my own personalized assessment to see how I did. So, 38%, obviously I'm not ready to take the NCLEX, but I can, kind of look through all of these different actions, see what I did correctly, and then also see what I missed, and kind of what I should think about for next time. I could run through the case again, try to get 100%, and improve basically my overall understanding and readiness for the NCLEX. So that is Maya Reyes. I hope I did the scenario justice, Sarah. And Michelle, I'll turn it back over to you.
Terrific. Thanks, Nick. And 38%. I've seen you do better, but acceptable today. Okay. Well, thank you all for attending. That's a wrap. We really appreciate you spending time with us today. We genuinely love these conversations and hope you're leaving with a clearer picture, or hope after you've watched the recording, you have a better understanding of what's possible for your students in your program. We will be at SimOps July 15th through the 17th in Tampa. So if you're going to be there, or you have a SimOps member of your team attending, come find us. We'd love to see you in person. As always, you can visit www.pcs.ai or reach out directly to sales@PCS.ai. Or if you're not sure of who to talk to within our org, info@pcs.ai. We're a small, responsive team, and we answer very quickly. So without further ado, thank you again for attending. Thank you, Sarah. Thank you, Nick. Very informative webinar, and we will be posting this on our YouTube channel as well. So check it out. I don't see any questions in the chat. So in this case, we'll leave it at that. If you do think of a question, please email us at those email addresses, or if you want to email Sarah directly, sarah@pcs.ai, or nick@pcs.ai. Or if you're unsure who to talk to, you can email me, Michelle@pcs.ai. So thank you again for attending. I hope everyone has a great rest of your day, and we'll see you at the next webinar, I hope. Thanks again. Take care.
Thanks, everyone.
Thanks.
Bye-bye.